Can having arthritis affect mood?
Yes, definitely. Anxiety and depression are both really common in people who have arthritis, and there's loads of reasons for that. So first of all, when you're diagnosed with arthritis, it can be a bit of a shock. You can be worrying about what's going to happen in the future, worrying about your work, worrying about your relationships. Next, having pain can often make people feel a bit low or anxious. Many people who are diagnosed with arthritis stop doing things socially, and they might be reducing the level of sports that they're doing, obviously, and reducing the amount of work they're doing, which can be a worry. And then lastly, if you've got pain, upset and worried, then your sleep may well be affected. So, and then that can make your mood even worse.
It's almost like having a rain cloud above your head all the time.
Exactly, certainly can be, especially at the beginning.
Would any of the specialist rheumatic medications affect the mood?
Yes, all medicines can affect mood in some way, either by causing anxiety or depression, but I think there's probably three most important culprits. So just paracetamol can cause insomnia and anxiety in about 1 in 10 people. It's really, really common.
Wow.
Yeah, methotrexate is a commonly used arthritis drug.
First line.
Exactly. It's less common there, but about 1 in 1,000 people will get changes in their mood with those drugs. And many of the more advanced medicines, so for example, biologics like etanercept, can also cause a change in mood or anxiety, and they can also affect sleep.
What can I help my mood if I can't take any tablets?
There's loads of things that you can do to help your mood if you don't want to take tablets, or if you can't take tablets for your mood. So first of all, one of the most important things you can do is to exercise. So get out in the fresh air, especially when the sun is shining. That can really help. It doesn't have to be vigorous exercise. Doing something like yoga or Tai Chi can be equally helpful. Talking therapies or just talking to a friend can be really useful.
So support side.
Exactly. And there's lots of evidence that a therapy which is called mindfulness-based stress reduction, or MBSR, which is an 8-week program of mindfulness meditation, can reduce anxiety by about 30%, which is more than the most commonly prescribed antidepressant or anti-anxiety medication. So there's loads you can do to help yourself.
Would it be the same with biosimilars?
Yes, absolutely, with biosimilars and probably with JAK inhibitors as well. Are there any foods that can affect mood when you've got arthritis?
People often love to know what they should eat. Now, it would be so tempting to put certain foods on the pedestal, but certain foods, they are really only part of the equation. We got to look at a much bigger picture, which is a dietary pattern. A seminal study came out from Australia looking at using a modified Mediterranean diet for 12 weeks to help see whether it will improve the participants' mental health. And they have found such positive results that a lot of other study is actually based upon using some kind of a modified Mediterranean diet, or even using Mediterranean diet as a foundation to help to improve mental health. Now, I know what you're going to ask me in just a moment. What exactly is a Mediterranean diet? It consists of lots of fruit and vegetables, having nuts as snacks, whole grain carbohydrates, fish, and little red meat. This modified Mediterranean diet added in 3 to 4 servings of meat and also 2 to 3 servings of dairy per week. And like I said, 12 weeks, really positive results, from the trial. And I think this is something that is definitely encouraging.
So does that mean that I can't eat pizza, or are there any foods that will make my arthritis or my mood feel worse?
Okay, yes, there are food that can make your mood worse. In particular, some of our fast food, highly processed, ultra processed food. In fact, they're all the yummy foods that we often reach out for. But in the long run, they are doing our mental health no good at all. So really, that kind of fast and ready, ultra-processed food is something that we should limit. And in terms of going back to your pizza, if you enjoy once in a while, there's no harm at all. Really, there's no bad bad food, but there's a bad diet.
Okay. How does exercise improve mood when you've got arthritis?
So far, the evidence pointing out to two mechanisms, psychological and physiological. In terms of looking at with the psychological side of things, exercise can enhance self-worth and also self-esteem. Just imagine that, if you get stronger, you will be able to feel that you can accomplish a physical task. I think that's more important because most of the times, when we see our patients, they feel that they feel useless, they can't do anything. But, I think the key thing is if we can give them that little oomph to support them, I think that will give them, a massive confidence boost. Now, in relation to the physiological side of things, we know that certainly, rather than saying no, we understand that neuroinflammation plays a huge part in depression. And exercise has been found to have an anti-inflammatory effect. Also, this is where I need to add in that the hippocampus, it is where the volume, the more sort of like research looking at the volume of the hippocampus plays.
What's the hippocampus?
Hippocampus is the mood central, and what the volume of the hippocampus will find that if you have got smaller volume, it tends to associate it with some of the mental disorders like Alzheimer's disease or even dementia. So the game plan, so to speak, is to enhance the volume or keep it as big as it is.
Yeah.
Now, exercise have this effect of helping the hippocampus not to shrink. I think that is one of the key game plan that we can look at. And when we look at exercise as a therapy.
What's neuroplasticity?
Okay, basically it means that it can help to change and also renew some of our nerves. And I think they play such a huge part, and exercise has the ability to do that.
So we can make new brain connections if we exercise?
Absolutely. And thus, what we can say is exercise is anti-inflammatory.
And being strong helps our mood.
Definitely. Being strong, good scaffolding, definitely help to keep the structure.
Mm-hmm.